How you guys doing? This is Wilbur Milhouse. Wanted to give you guys an opportunity to chat with a medical professional related to coronavirus and the impending vaccine that's coming up. And I asked my doctor, Dr. Ari Levy, to come in and have a conversation with me to share this with you guys in hopes that we can educate you, or I'm getting educated as we speak because a lot of information is coming, but wanted our family, our Milhouse family, just to be more educated and have an opportunity to ask questions. That's why I asked for the survey to be put out. And then I'm going to have an opportunity for you guys to be able to reach out to Ari and his team as a follow-up if you have follow-up questions. So first off, Ari, welcome. Welcome to our Milhouse family. We usually have lots of fun, lots of great people, but wanted you to just introduce yourself and introduce yourself to my team, and then we'll get into some of the questions they had and some of the questions I have. And you can just chat about anything that you feel we just need to know related to coronavirus as well as the vaccine, just for education. All right?
Sounds like a plan. So first of all, hi everybody. I'm Ari, Ari or Dr. Ari, and it's Wilbur. It's a pleasure. I'm a doctor, and as I tell people, I'm really a pain in the butt. I'm a caregiver, and that's what I do day in and day out. And I have a really easy job. And if you want to know how much of a pain in the butt I am, just ask Wilbur. But it's not about what we do here is we have an integrated medical practice. So I have a team of experts that do three basic things. We assess who you are and where you're at. We care for you, and we help connect you to the right resources and support that you need to build your health. Because what we believe is that health isn't built inside the doctor's office. When you're in a doc's office, he or she doesn't actually make you healthier. They tell you you've got certain things you got to handle. And so health gets built outside of the four walls of a doctor's office, and it's really predicated on having a strong relationship, really strong communication. And we've got a group of people and a facility here in Chicago that does that. I'm very passionate about what I do, sometimes loud and aggressive, to help people live better, meaningfully and measurably. So thanks for having me.
Welcome. So maybe we'll jump into some of the questions, or did you want to just start off just talking generally about coronavirus and the status or the state of the world today?
Yeah, why don't I I'll do a little bit of talking, and then you'll just interrupt me, because I'll get on a roll and keep going for a little. So a few things about coronavirus right now. First of all, there's a light at the end of the tunnel, right? So there is some hope. And what I want to say is, yes, there is light at the end of the tunnel, but patience and persistence and respect for the disease are super important. So we've come this far, and we want to make sure we get to the end without getting it or taking the necessary precautions. So I tell everybody all the time, masks, social distancing, strong and proper hygiene are really, really effective at reducing the spread. And sometimes it feels hard because this pandemic, is coming up on closing out its third quarter that we're going to be dealing with it. And I don't know about you guys, but that's, really tough. We are experiential. You guys are out in the field. It can be challenging, to have our worlds restricted. So that's first and foremost. What we're also seeing with the virus is that it is not as lethal as we thought it once was, right? So what do I mean by that? There is what's called your infection rate and your infection fatality rate, different rates. So how infectious, is it, and how likely is it to kill you? That infection fatality rate continues to come down. So that's a really good sign, right? That it is a virus that's mutating to be less severe for folks. Now, you read in the news and you read everywhere, we're in a surge, hospitals are at capacity. How could that be if this virus isn't so lethal? Well, what I tell everybody is it's a math equation. Okay. What's the equation? Well, the equation here is about the number of sick people at any one given time. And if we have 70 to 80 million people above the age of 60, which are in the highest risk categories, and you have some folks, let's call it another 15, 20 million with chronic conditions who are at very high risk, then suddenly you've got 75 to 100 million Americans, right, who could need hospitalization. Now you take those 175 to 100 million Americans and you say, well, let's say only 3%. That's still 3 million Americans, right? Say it's 2 to 3 million Americans. It's a lot of people in a hospital system. We're talking about hundreds of thousands that are being hospitalized right now, and our system is feeling that capacity, right? And so that's why the public health officials get so concerned about surging rates and number of people getting sick and flooding the system that doesn't have the capacity. Because the last thing we could handle as humans, as Americans, let alone, is to see people not getting the care they need or to help them live. Does that make sense?
No, it makes perfect sense. It's kind of like we know more today than we knew 8 months ago, and we'll know even more 6 months from now than we know today. And we know how to possibly handle it a little bit better, and what to do and what not to do, versus 8 months ago, we were kind of taken off guard and didn't have all the right answers. I would think that's part of the what's going on.
Absolutely.
So how infectious is this related? How long does a person stay infected generally?
Yeah, so generally speaking, a person stays infected for about 7 to 10 days. That's the average range. Now, of course, you have people that are just a couple of days. You have asymptomatic people who don't even know. You have people that have just a couple of days, 1 to 3 days. Then you have the average range of 7 to 10, and then you have some people who linger for 2 to 3 weeks. So what we talk about is, the reason they say 14 days is because that gives you the 7 to 10 days to heal, and then make sure that you're not having any not second wave, but the symptoms of COVID wax and wane. So what ends up happening for people is that they feel sick one day, feel much better the next, think they're better, but then feel sick 2 or 3 days later. So there's this cyclical nature where they go down and come up, but then they gradually get better. So you want to give your body and self time, right? The last thing you want to do if you've gotten it and have the symptoms is go back and spread it to others.
Yeah, absolutely. So side effects, many people are hearing related to the vaccine is here. We watch on TV that they're starting to administer it here in America. What side effects could I get? And is there a different side effect between the Moderna and the Pfizer?
Yeah. So great question. So if we talk about vaccine now, there's a few things to consider. One is the Moderna data is coming out. I think it is just posted. So we'll be reading about the Moderna stuff. The Pfizer was last week. And having read through the documents, here's a few things to consider. The number one side effect that this creates for anywhere from 1 to 3 days is flu-like symptoms. So fever, headache, chills. As you might say, well, if I get corona, I'm going to get that. If I take the vaccine, I might get that. What's the point? Well, the reality is this is what's called a recombinant mRNA. So they're basically the way, this is not a live virus kind of thing. This is a created virus. So the body creates what we call that signal cascade of mounting an immune response, which is a positive thing. That means your body is attacking that, taking it in, understanding it, and preparing or creating the antibodies for it. Does that make sense?
Yep, it does.
So there's one quick thing before I let you go. So that is the main side effect we are reading about. We also, and you'll see in the news, what's called an anaphylactoid reaction. It's like anaphylaxis. All that really means is when they say anaphylactoid, it means similar to anaphylaxis. So there are some people who have various allergies who have experienced the flushing, some of the swelling, etc., which is why we watch you for most folks 15 minutes, and for folks with the anaphylactoid phylaxis reactions, we watch them for 30 minutes to see if we see that afterwards.
Okay. So flu, we normally have a flu vaccine that comes out yearly. Is this probably going to be a yearly thing, or do we know?
It's an awesome question. It's an awesome question. You know, as my wife would say, if you ask me a question, I always have an answer. Should I have an answer? I don't know. But the humor here is, or not the humor, but the seriousness here is, we actually don't know. As a betting guy, I think, you know, if I had to rely on the data, I would imagine it over time to continue to mutate. We are learning for the first time about these new types of vaccines, these mRNA vaccines that we've never had before. So they're slightly different than what we've been using in the past, you know, what we call live or attenuated vaccines. And so I think we have a lot of learning. And to me, I think that's the hardest part about being, you know, a citizen with real-time information immediately and a bunch of marketing, right, and media that comes at us is, well, I want the answer now, right? Like, why can't we get it? And you know, as I've told people, I think it's nothing short of miraculous that in under 9 months, right, we have a vaccine, right? And quite frankly, we have had this vaccine much sooner than we anticipated, and it's demonstrating, at least preliminarily, to be remarkably effective. Now, time still, you know, we still got to get through and see what happens, but so far so good.
Okay. So if I've had coronavirus and I got tested, I just saw that I had coronavirus, should I get this vaccine, or am I good? What?
So great question. So so we are recommending, and it is recommended, that you do get the vaccine. Okay. Why? Because we don't know how long your immunity and your antibodies last. We don't have that answer yet. So when people will say, well, you know, look, I had it, I got my antibody test, I have antibodies, my answer is, well, what kind of antibody test did you have? What did you test positive for? IgG, IgM, IgA? Was it a qualitative antibody? Was it quantitative antibody? They're all different answers, right? And, you know, that's not to, you know, play doctor. It's just to say we are gathering all this information, and in a you know, what, in a pandemic, in this context, first thing we basically have to do is contain the problem, right? Which is why we shut everybody down. Understand the disease, which is what we've been doing, you know, in the acute setting, right? You got to stop people from dying right away, which we have done a much better job of. And then in terms of the prevention, right, we've created this vaccine. Now people want to say, do I need to take it or not? It's a very good question, but one which I think is what I call second or third order in terms of requirement to answer. The data and time will tell us, and then we'll have very good information. But for right now, I'm getting the vaccine as soon as I can.
Got it. I know one of our team members asked, you know, when can we as Milhouse, because we're in the essential business, get it? And the answer to that question is, we're not going to be very high on the list. It's going to be the most critical individuals, those individuals that are coming in contact with individuals on a daily basis. So nurses, doctors, so forth, and then first responders, of course, will be high on the list, and many of the individuals that are super at risk, the elderly. And so we're going to be in one of the last tranches, generally with most of the general population. So we won't have any super preference in that way. But related to the fact of should we get it or not, you know, me and you had a conversation of, hey, think I may have had it. I'm not sure. I don't feel symptoms today, but I want to go get one of these antibody tests. And you were pretty much like, well, what is that going to tell you, right? And I think you kind of mentioned that there, which, I went through some struggles back and forth. And I guess I said, what is it going to tell me? At the end of the day, it seems like we still need to get this vaccine, regardless if you may test positive for having antibodies. You probably still should go and get the vaccine.
Yep. So knowledge is power, right? Because knowledge educates and provides us an ability to make good decisions. And antibody testing has its place in certain contexts and situations. And as you and I discussed, it doesn't change your daily operating, right? And so that's one of the reasons why not to get it. I think, look, Corona is teaching us, right? I think that's the thing is Corona is really teaching us about folks. What I would tell your team and everybody here is, depending on the county you live in, so whether it's Lake or Cook or McHenry, your county and the Department of Public Health probably has a way to sign up, or will be having a way to sign up if you're concerned that you're a very high risk. So, that is going to be deemed by them, I believe. Right now, Fauci is saying he thinks March or April, the mass population will be getting it. I'm a little bit more skeptical, but I mean, hey, if he's able, if we're able to deliver in March or April, we're all going to be happy. I imagine it to be May and June, but nonetheless, I think that's when it'll become much more accessible. And let me also say one thing about this really quickly. There is going to be a group of folks that once they get the vaccine are going to be like, screw the masks, I don't need this anymore, done, right? Sure, that's an interesting concept, but just know that you could be harming others. Just because you may not feel it is part of why we do flu vaccines, and is make sure we're not vectors of transfer. And so that's a really important part. I think respecting each citizen and making sure that we're doing our part. I think the masks will go away soon enough. But again, this is where, going back to the beginning, patience, because there's light at the end of the tunnel and it's coming, and we all want to, speaking for myself here, get out and have a good time.
Man.
Yeah. Right.
Get
like,
rid
can
of the
you
mask
imagine?
and go out and have dinner and hang out.
Hug your friend.
We're a family of having parties. So we just celebrated our 19th year and we couldn't have a big bash. So I'm really sore about it. So we'll probably do it when all of this clears up.
Your 20th is going to be off the hook.
Absolutely. You'll be invited for sure.
Yes.
You'll be invited.
I'll be there.
You'll be invited for sure. So I think I heard that you can still be a carrier even after you've had the vaccination. Is that true?
So there is the possibility that the vaccine doesn't work, right? Because the vaccine is 95% effective. So we don't know. And it's 2 doses. So, what I tell everybody is there's a process here. And if you're at the front of the line or close to the front, respect the people at the back of the line.
Gotcha. So some of our folks were concerned related to if I have health issues, high blood pressure, asthma, cancer, heart conditions, sinus allergies, ear, nose, throat kind of stuff. Mm-hmm. Should I be concerned about taking this vaccine if I have any of those underlying conditions?
Nope. You should talk to your doctor. So most importantly, make sure you've got a good doc that you can ask these questions to. But this is part of why it's here. If you've got immunosuppressive issues, you may have your response might be slightly varied. on and with the vaccine, but it is meant for all of us. But again, it's the conversation to have with your doc.
What about for individuals that would like to get pregnant and females? Does it affect fertility or anything like that, even with males?
Yeah, I don't have the answer to that.
Okay.
I'd love to give you an answer. I don't have an answer. Some of these
this is another one of those, as more people take it, we'll learn more and be
starting, they started early December. So the vaccine is for people 16 and older, nobody under the age of 16. Now, why is that? Well, it's because if you look at the data around what we call absolute risk and relative risk of death, it's extraordinarily low 16 and below, right?
Sure.
It's really low, 29 and below. But young kids, it is not killing them and adversely affecting them the way it is, the average population. So we are just, Pfizer and Moderna early December just started vaccine trials on kids 12 to 16. So we'll get under 12 after that. But again, in terms of triage and prioritization, they're the lowest on the list.
Gotcha. That's pretty much most of my questions. I know I'm going to take it as soon as we can, and I'm going to sign up to have that happen. Did you want to share anything else with our folks that just off the top?
Yeah, I don't, off the top, I don't have a lot. If you guys have questions, there are some, I think, Wilbur, I might have given you this.
How can they contact you?
If you guys want to shoot me an email at ari.levy@shiftlife.com, you totally can. What I have to be explicit about, just so everybody hears, is I am not and cannot act as your doctor. You can certainly sign up and join Shift, and would love to have you as a member, but I can't give medical advice out to individuals on one-offs. That's my legal team would, have my head on a platter for that.
We all got a legal team.
Yeah, we all do. And they do their job to help protect us from ourselves. So, I think if you have questions, again, ari.levy@shiftlife.com. You can reach out 312-566-4210. Give us a call. And I'm happy to answer, any questions you might have.
Perfect. Well, thanks, Ari. Appreciate your time. And, I'll be following up with you because sometimes I text you in the middle of the night and be like, what the hell is this? But hey, guys, again, if you have any other questions, definitely you can send them to me as well. Or we can just have chats related to what's going on related to this. And I'll keep you guys as informed as I am. And you guys have a great rest of the week, and look forward to when we can get together and have some fun. Talk to you guys soon. Thanks, Ari.